Broadcasting from New York City to the world, it's the G-Man Interviews.
A home health aide who neglected, stole from, and then murdered the 79-year-old man she was supposed to be caring for will go to prison for 25 years to life. Jennifer Lukey has the emotional reaction as Sarah Moore was sentenced today in Albany County Court.
35-year-old Sarah Moore admitted to killing Richard Englander, a decorated Army veteran, brother, father, and grandfather that she was supposed to be taking care of.
You went out to the garage and got a tire iron. You repeatedly struck him with the tire iron, blow upon blow, so the post-mortem couldn't tell how many times he'd been struck. You then got a kitchen knife, stabbed him.
And I've been a judge for 20 years. Rarely have I seen such a thing. And you did it because you, quote unquote, just had to get high.
Richard Englander's family had a chance to address the court, specifically Moore, before she was sentenced.
The very last thing I said to her was, please take good care of my dad. And then 4 days later, she brutally murdered him by her own admission.
What possessed you to steal and to murder? It's unconscionable.
She could have stopped at just neglecting him. She could have stopped at just stealing from him. My dad was defenseless in his recliner and she chose to brutalize him. Because of her bad choices, I pray she never sees the outside of prison.
I hope you never see the light of day. And you'll never know the love of children, grandchildren. He did, and you took that away.
When asked whether she had anything to say for herself, this was Sarah Moore's full comment to the court.
I would like to apologize to the family of Richard Englander, to my family, and to everybody that's been affected by this. I was wrong. I regret what I did. I will share my story, try to help people with similar problems. May God have mercy on my soul.
25 years to life was the agreed-upon sentence, but the judge made it clear he believes she deserves more.
For whatever it's worth, I hope that the Division of Parole denies parole and keeps you in custody for the rest of your natural life.
In Albany, Jennifer Lukey, CBS 6 News.
Welcome. The following news reports were also filed in the state of New York in 2014. On April 2nd, the Bronx Division of News 12 reported that Maria Milano, who worked as a home health aide, had been charged with 13 counts of assault, 2 counts of welfare endangerment, and harassment after allegedly abusing Isabel Sosa. Sosa, 76, suffers from Alzheimer's disease and dementia. Sosa told her son David that Milano would repeatedly knee her side, hit her legs, choke her, and left a lump on the back of her head. On September 11th, the New York Daily News reported a 99-year-old Staten Island man was still living at home, headed towards his 100th birthday, until hired home health aides killed my father, the man's distraught daughter says. Disturbing surveillance video captures the horrific abuse inflicted in the months before Peter Mazza's death this summer. His family members say aides working for the Nurse Service of New York and Partners in Care were hired to provide round-the-clock care for the ailing elderly man, but instead, the aides were negligent and abusive, leaving the man to fend for himself after one April fall that left the man with fractures and head injuries, the suit claims. He died in a nursing home weeks later after deteriorating in a hospital. Mazza never had a chance to return to his Oakwood home on Montreal Avenue, where the grandfather of 13 spent 47 years raising his 5 children. Jack Halpern is the CEO of the New York City-based My Elder Advocate LLC. As its name suggests, the organization provides advocacy services and helps seniors with issues such as eviction prevention, nursing home and hospital crisis intervention, nursing home or assisted living placement, and long-term care planning. Mr. Halpern joins me to explain why abuse by home health aides has reached a crisis point in New York, as well as other sections of the country, and what can be done to address the problem. It's a pleasure to welcome you to the show, Mr. Halpern.
Thank you very much.
HHAs, or home health aides, must be licensed, but they don't have to be fingerprinted. Explain why.
That's probably not a regulation that the New York State Department of Health requires. I think that a person that is dealing directly with an elder should be fingerprinted. A proper background check has to be done, and records in all states have to be current. If you hire somebody and try to do a background check on somebody that lives in New York, and they have not committed a crime in New York, you're able to hire them. But if they committed a crime in New Jersey, you're not going to be able to find out about it. So a background check has to be so thorough that a person's record all over the country and even internationally has to be checked, so that if they're not a good aide, then they have to not have access to caring for an older person.
Do you find it astounding that in light of these cases, there's still no measure to have these workers fingerprinted?
It's absolutely astounding. I mean, why would we not want to check the backgrounds of people that have such a direct impact on our elderly? Everything should be done, and this has been years that this has been going on. I'd say probably 7 or 8 years ago, we weren't even required to do background checks in nursing homes and licensed home care agencies. Everything has to be done to ensure the safety of these people. We can't have sex offenders and criminals and people who abuse patients in one state being able to move over to another state and get a job taking care of the elderly. It is absolutely astounding, and I don't know why the government is so slow, to get this done and to put this into effect. Everything should be done.
Is it true that the majority of home health aid agencies don't require potential employees to be fingerprinted?
I have never heard of a requirement that they be fingerprinted. I'm sure that the really good agencies do whatever they can do to try to get them fingerprinted. But it's not just fingerprinting. I mean, you have to be able to check those fingerprints against various databases. So if you can only check it against the New York State database, again, you have the same problem that they haven't committed a crime in New York State, but they've committed a crime across in New Jersey. And fingerprinting is an expensive situation. So a lot of agencies do not want to spend that money, but I don't believe to this date that it's a requirement to fingerprint home health aides, whether it's in the home or it's in nursing homes.
So again, anybody coming through the door applying for a position, it's a crapshoot.
It's a crapshoot. It's an absolute crapshoot. But the agency that hires these people, it's not just a matter of fingerprinting them and getting a proper background check. They have to supervise these people. They have to watch these people. They have to do surprise visits. I've been urging a lot of families to put in cameras when they hire a home health aide. Just like people will put in these nanny cams to watch their kids, why wouldn't they put nanny cams in to watch the home health aide? Don't just bring in a home health aide from an agency and rely on the agency that they've done a proper job. You have to do your own job, and I tell my clients, when you get the aid from the agency, you want to check the references of this person. Okay, you want to make sure that they have a background check. You want to make sure that they were fingerprinted. And if an agency tells you, well, we don't fingerprint our employees, the answer is, if you're going to do everything just as it's required and not take the extra step to ensure my loved one's safety, then you're not the agency for me. But there are not so many choices of agencies. I mean, there are a lot of bad ones, a few good ones. And it's very hard to choose from, all these agencies pretty much have the same procedures. If they don't check background checks and they don't check fingerprints, then they're all not doing it. You have to do your due diligence and not just accept somebody that comes through the door assuming that the agency has done everything, or you have to make sure to pick the right agency. I always tell the clients of my elder advocate that they must have somebody. It's not just enough to get these services. They have to have a professional, whether it's me or somebody else, who is watching these people, monitoring their people, and making sure that they do what they're supposed to do. There are many dedicated, wonderful men and women who do this work. They're very dedicated. But if the agency is a bad agency, even the most dedicated person is not going to do what they have to do because it's a difficult job.
I received 3 emails from people in high-ranking positions here in New York City detailing their bad experiences with HHAs, and I'd like for you to provide a comment based on what they said.
Sure.
They asked that I not reveal their names because of their affiliations with prominent healthcare organizations.
Absolutely.
The first statement was from a manager of personnel for a senior care facility in Manhattan.
Okay.
During her search to locate an HHA for her late mother, the agency sent what she described as very shady people to her home, and she quickly dismissed them. When the agency proclaimed she need not be so picky, she fired back, "I'm a manager of personnel for a major senior care facility, so I know what an exceptional candidate looks like." The second person, an accomplished and respected actor, stated, "I dare say that one of the problems is this industry is run by private businesses that only care about the owner's bottom line. They don't pay their home attendants a living wage. Who do you think is going to do the job when you aren't willing to pay them for the very difficult and often unsavory work that they have to do? And this is not to sully the reputations of all home health care workers, because many are really good people just trying to make a living. But if you don't pay a living wage, that opens the door to crimes of opportunity, and of course, in some cases, people who go into that line of work because they think it's easy money." Then he goes on to note, "We had to find HHAs for my grandmother, who died maybe 20 years ago. She insisted on living in her apartment, so she needed 3 people so she could have 24-hour care. My aunt and uncle interviewed and interviewed until they found 3 they liked. Within a week, they had to fire one because she was stealing jewelry and money. 2 weeks later, a second one was fired for being abusive. Not egregiously so, but any abuse is unacceptable.
Correct.
The third one they all liked and decided they could work with her, and the family would fill in at other times. Within a month, the attendant's mother came down with cancer, and she had to quit so she could take care of her.
Okay.
The third person, a renowned pastor in the Bronx, whose mother was victimized by not 1, not 2, but 3 HHAs, said it was one of the worst experiences of her life. She has a background in social work and shared something with me that was completely shocking. When I asked her who generally provides referrals for HHAs, she told me it was typical for doctors to give referrals to HHA agencies. Well, if an agency has a bad reputation or has had employees arrested and charged with crimes, and the doctor is aware of it, what does that say about the doctor?
Doesn't say much about the doctor, but absolutely everything that you said is absolutely true. While I certainly would like to preface that there are good home health care agencies, the majority of the home care agencies pay a very, very small wage. Most of them depend upon government money. They depend upon Medicare and Medicaid. And Medicare and Medicaid reimburses at a very low level. And agency owners, of course, they're in for a profit. They don't receive as much money as they would like to receive, so the money that actually goes to the aide is a small wage. It's not a living wage for these people, because agencies always have their profit margins in mind. Now, if you're not making a lot of profit and you're relying on all Medicare and Medicaid people, and you can't pay much money, you're not going to get much quality. All right? Now, this young lady in personnel, she says that she interviewed these people. 9 out of 10 times, there is no interview process. The agency will call up, say your mom's in the hospital and she's leaving the hospital and she's going home. Okay, the hospital discharge planner will say, here's a list of 5 agencies. Okay, and she says, okay, she picks one of the agencies. He calls the agency says, tomorrow when your mom is home from the hospital, somebody will be showing up at 8 o'clock. That's it. That's the interview process. They don't send people to the house on their dime for you to interview them. So you're pretty much stuck with what you got. Now, it's a basic principle of life. If you're going to pay somebody a decent wage, you can ask more from them. But if you're going to get somebody who you've checked their background, you've checked their references, and they're wonderful people, and then you're going to tell them that you're going to pay them basically as much as if they were in Burger King or McDonald's, and then you're going to tell them you have an elderly gentleman here who has, say, Alzheimer's, okay, and they're always confused, and they're incontinent, so you have to be changing diapers, they have to be cleaned, and they have to be lifted out of bed, and they're constantly up, and they constantly have to go to the bathroom. You tell a person like that, you have to take care of this person like a whole day. And I'm going to pay you $8 an hour or $9 or $10 an hour. I mean, you know, they talk about the minimum wage going up to $10.10 as if $10.10 is a whole load of money. It's still on a 40-hour week. It's $400, $1,600 a month. I don't know many people that can pay rent even in a bad neighborhood and then still buy food. So the other problem that happens is these people, in order to make money, because they get such a low wage, they have to work 2 shifts in a 24-hour period. Now you can just imagine if you're getting the second shift from a person, they're going to spend time sleeping on the job. And if they have an elder person who needs a lot of care or needs to be lifted and needs to be fed, they're just not going to do it. They're just not going to do it. Not everyone, of course, there are many that are dedicated, but if you work 2 shifts in a 24-hour period and you're constantly taking care of somebody, you're going to get burnt out very quickly. We must take care of our caretakers. We must take care of these people. These agencies are not doing it. And the more profit they make, the profit comes on volume, and they are going to pick even those that have the rules with the background checks. Who knows what kind of background checks they do? And who knows that when the background check comes back bad, but they need somebody to put into that home, they're not going to put them in the home.
We're looking at this from the wage aspect.
Right.
But there's another component that I believe is equally important that I've never heard addressed. When a person applies for a position as a New York City police officer, they have to take a physical and a psychological.
Correct.
Why isn't the psychological component taken into consideration when you look at cases of abuse that are taking place across the country?
A policeman is an important job, but a home health aide is an equally important job. I don't know if a psychological test would really root out, what their problem is. There's 2 things to worry about in a home. You have to worry about the like you said before, the money aspect, the stealing. I mean, if you're going to put poor people into that kind of situation and you haven't checked their backgrounds, they're going to steal. I spoke to many bank officers, for instance. From time to time, they will see an aide coming in with an elder person withdrawing a large amount of money. who they know never withdrew this kind of money, and they'll stop it. But other times it's not stopped. I mean, these people can force somebody to go to an ATM machine every day and take out money. But that's the fact that they don't have money and they don't make a lot of money. But the biggest thing is you can't really, if they're abusers of the elderly, whether they just like to abuse people, or they're angry about their lot in life, or they're angry about their wages, or they're angry about the man who makes all the money in the agency and gives them nothing, and then, takes away their days off and abuses them and treats them badly. A psychological test, one psychological test, is not going to do it. But the point is, even that little we need every single tool. But these agencies are not going to keep the laws. A lot of these people, they don't obey the law. They'll do a background check, but they'll ignore it. So it's the profit motive. Now, the profit motive can be good and bad. It could be a person who could say, look, I'm going to run a private home health care agency where people pay privately, and then they can hire better people. Or they're going to say, I'm getting all my money, Medicare, Medicaid, I don't have enough money to pay these people. I'm going to cut corners. These people cut corners. I mean, they're going to cut corners, and they're going to send somebody in there who they haven't checked. Maybe they're new. They won't even check them. And these things, and I've seen this in the homes. Many of them, I go into a home and I see the elder is dirty. The elder is hanging down in the wheelchair. Well, what are you doing? Or many of the people who have cameras indoors and they found abuse and neglect. They have to be regulated by the Department of Health, and they have to regulate themselves, and when they are caught, their licenses have to be pulled. If you're a cab driver in New York and you have 3 violations, your license is going to be pulled. Why? Because you're a danger to society. Why is an agency photographed abusing somebody and remain in business after paying a small fine? 3 strikes and you're out.
Well, you cited a case where there was a client that was being abused by 3 HHAs?
VNS.
Visiting nurse service.
Visiting nurse service, and this is on the records. It's already, I was on on CBS News about this particular case. 3 different aides. One of the aides, while this gentleman was trying to get out of bed, and he finally got out of bed and he hurt himself, was up. This aide, this orderly actually, was sleeping on the couch with his little daughter sleeping next to him. He brought his daughter along to the home. These were 3 different aides who abused this elderly person, who eventually died from that abuse. If you have 3 different aides from the same agency, then VNS is doing a very bad job of vetting these people, of checking out their background, and they're doing a very bad job of supervising. So they should not be in business, but they're the largest agency, or they should be fined enormous amounts of money. But no. I'm sure that VNS got a nasty letter from the Department of Health, but they're in business. They're advertising all over. I tell my clients, no VNS. Oh, but visiting nurse service. And every hospital pushes VNS when you get in there if you need home health care.
Everyone.
Everyone. Top of their list, VNS. People who go to hospitals and have to go home with home health care, they need somebody quickly. And they rely, when a hospital discharge planner stands there and tells you, we recommend VNS, even though they're supposed to get more choices, you're going to take VNS because you watch television and you hear about VNS. I guarantee you, these 3 people who abused this gentleman, 3 different people, I would guarantee that at least 40 to 50% of the nurses in VNS are not doing the proper job. And these 3 people could not have been vetted, And they could not have decent references because I can't imagine somebody giving these people decent references. I mean, they literally allowed this gentleman to fall on the floor and lay on the floor without picking him up. One of the aides was actually angry at him because he wasn't staying in one place. These aides probably didn't feed him properly. They probably didn't change him properly. He was dirty and filthy. That's not a violation of the law. That's a crime against humanity. That is outright elder abuse.
During your tenure in working in these communities and with this populace, have you contacted elected officials and submitted your findings or reports to them? And if so, what was their response?
Throughout the years, I'm in this industry 41 years. I used to run nursing homes. I have been after every politician until such point that I've given up with politicians. I met Joe Bruno years ago at the Roosevelt Hotel after Cuomo had decided that he was going to do this Medicaid redesign work so that they can cut their Medicare costs in home care. It was a terrible situation, and I complained about it to Joe Bruno. And I complained to him about some of the nursing homes in his home district that were horrible places. And he said to me, you know, Jack, he says, you need to be patient. These things take time. I said, I'll tell you what. I said, this nursing home in the Bronx is a concentration camp. It's a concentration camp. It's the worst nursing home, and it keeps getting worse. And people are in danger. I'll tell you what, if you put your wife into that nursing home, I'll wait as long as you want. There's nothing to wait about. There's no reason to write new laws. You have to enforce the old laws. The old laws are fine. The law says you can't abuse or neglect somebody in nursing homes, in home. Why even bother giving these people licenses? The politicians are not nursing homes and home health aides and Medicaid. They destroyed the home care system in New York. People used to get 24/7 care, and they stopped it. Now, in order to get home health care on the Medicaid, you have to wait 3 or 4 months. So what is the hospital going to do? They have somebody who fell and hurt themselves, and they can go home. They're fine to go home, but there's no one there to take care of them. As a matter of fact, the discharge policies, according to the law, say that you can't even send them home unless you could send them home with good care and that they're going to get the care that they need. They're not allowed to send you home. So what have they figured out? They're not going to leave somebody there for 4 months. They send them to a nursing home. They go to the nursing home. They get rehab, even if they don't need rehab. Then they stay in the nursing home, and they never get home. And they become long-term care patients, or they get evicted after Medicare days are up. You got to look at all your reimbursement that you have for a patient. You got to come up with an amount that a person needs, and you have to divide that equally. Medicare is paying $650 a day for someone, and Medicaid is paying $300 to a nursing home for long-term care, which they can't live on. So who are they going to take? It's against the law to discriminate on rehab. Anyway, the point is the home health aides have to be paid a decent wage. And in order to pay a decent wage, Medicaid and Medicare has to reimburse. But then you have to find out those agency guys who are really profiteering on running these agencies. And if they're not doing what's supposed to be doing, you got to get down on their necks and break their necks. You got to put them the hell out of business. You have a factory that's producing iron ore, and, you know, they're not following all the environmental laws and things. Yes, it affects people in the long run. But when you have a home health agency, you have human beings taking care of very frail, elderly people who are broken. You have to put them out of business because chances are they're not going to change their colors if you catch them once in a while. And you can't check care based upon paperwork. We have a healthcare, a long-term healthcare system in New York and across the country that is based upon inspection by paperwork. They come into a nursing home, they look at the paperwork. They go to a home health agency to inspect them, they look at the paperwork. Now, if I'm abusing a patient, do you think I'm going to write on the chart, today I abused Mrs. Smith? If they abuse somebody in a nursing home or they abuse somebody at home, they'll send them to the hospital. They fell on their own. They fell, now I'm sending them to the hospital. It's too easy to get away with. And when you have agency after agency, and all the home health care agencies in Brooklyn, in the other boroughs, but mostly in Brooklyn, they're all owned by the same syndicate of people. Okay? People who are in this business to make a buck quickly and will cut any corners necessary to do it.
Has there ever been, or is there currently, a special task force in place to conduct investigations, to follow up on basically most of them?
Absolutely not.
Never has been.
Never has been, but there have been agencies that have been caught defrauding the government repeatedly. There was a case a couple of years ago against this agency. If I can get off just to give a quick background, what happened before the Medicaid redesign team came along to cut Medicaid costs in home health care, you had the same agencies, they were called CHAs, Certified Home Health Care Agencies, CHHA. They were only allowed to take care of a certain population. One agency was allowed to take care of only mentally ill people. One agency was allowed to take care of only Holocaust survivors, all kinds of criteria. But what they did is they started to take everybody. And everybody was able to get 24/7 care because these people were making billions. And not everybody needed it, but they were getting it anyway. It was easy to get. So what did they do? They come in, instead of taking these guys and putting them out of business, and they were all politically connected.
All of them.
All of them were, okay? The owner of the agency was actually Governor Cuomo's main Long Island fundraiser. And he owned an agency with his wife. And it's an article. I could show you the article. It was in the Village Voice and the New York Times. And this agency was accepting every single person, even though they were only supposed to take disabled people.
What was the name of the agency?
The name of the agency was Excellent Home Care. A bunch of crooks made billions of dollars. It was to the point that they were being investigated by the Attorney General, and Cuomo sent back a campaign contribution to this guy whose name is Howard Fensterman. He's an attorney for most nursing homes. He owns nursing homes. He owns home care agencies. They own all kinds of facilities, this guy. Very, very connected. When Cuomo was running for Attorney General, he was his main fundraiser on Long Island. Now he's helping the current Attorney General. Schneiderman. Now, when they got caught by the Attorney General, they got slapped on the wrist. $3 million. And they didn't have to admit any wrongdoing, even though they were stealing day by day. They're still in operation. So what the state did to substitute for the CHAs, or the Certified Home Health Care Agencies, he put in something called managed long-term care. Everyone was going to go on managed long-term care. The CHAs, suddenly, all the patients that they had that were costing them a lot of money, They dropped them illegally. And none of them paid for that. None of them paid back for all the people that they weren't supposed to take. Howard Fensterman was told that he has to get out of the agency. So he gave it to his wife. And they're still operating. They've been investigated half a dozen times. Now, I'm not a suspicious guy, but Cuomo, campaign funds, the MLTCs are destroying home health care system.
MLTC?
MLTC is managed long-term care. They're basically insurance companies. Now, here's the kicker. All these guys, Excellent Home Care and AmeriCare, which is another one that was defrauding the government, and every time they got caught, they paid a fine without admitting any wrongdoing. They all applied for MLTC licenses so they could continue, just different rules, okay? And most of their aides were terrible aides. One of the scandals that they went through is they had an arrangement with a school to give them certifications, and the school never gave them certifications, so they were uncertified. This happened. I mean, it's in the papers. It's in the news. I mean, I get crazy about it. So what am I going to do? Am I going to go accuse Cuomo? But the result is that many people lost their home care because of these people, and they went to nursing homes. There's an article in the New York Times, I'll send it to you, and they died, either from depression or because they suddenly moved out of their houses. And these people never paid for that. And many people today cannot get home care. All these nursing homes are defrauding the federal government. They even force people to get rehabilitation so that they could $650. My elder advocate goes into the hospital and tells the discharge plan, this person's not leaving this hospital until I find a nursing home for them. I have a guy in Methodist Hospital now. Okay, he's there for 6 weeks already because I can't find a decent nursing home that has a ventilated unit. Now, I'm not just a watchdog. I mean, this is a business to me. But this is what I do for people, and this is what other advocates and professionals. When you're doing this, you don't do this at home by yourself like you tell the kids. Unfortunately, the system is so bad that if we're not going to be able to change the system, then we have to have somebody who's going to monitor this care. And many people can't afford my fees, and they shouldn't have to pay fees.
Well, with everything that you've laid out, you paint a very gloomy picture.
I do.
So, that being the case, what recourse do people have? I mean, what would you say?
I would say to people, relying on a discharge planner in the hospital is a bad idea because they will tell you anything because they want to just empty the bed. They don't care where they go, whether there's a substandard nursing home or a substandard agencies. They don't vet people. They just have a list of their buddies, of the people that a lot of them, I'm not saying all of them, they get money from these people. These people go into hospitals from the home health agencies, and they give them, if they don't bribe them outright, they give them theater tickets, and they have their favorites. And if I have a good home care agency, I don't have to go to you to bribe you. Yeah, maybe once a year, I'll buy you a $50 gift. I'll buy you a ticket to the theater or restaurant. It's the same thing with nursing homes. They have people all the time to get these patients in for rehab. Don't trust the discharge planner. Do your own research. Call these agencies. Ask them about their vetting policies. And then say, I want to meet some people. I want to check them out. I want to check their references personally. And then you call up some of their jobs and ask them, what happened? Did you have a good experience? Now, if the discharge planner is going to be time consuming, tell the discharge planner that you're not taking your mother out until you do the proper work, and you don't have to care what they say. They can't kick you out into the street. You have to take the time to do the diligence or get somebody who's a professional and have them do it for you with a track record. All right? So we find the right agency. New York State has rates agencies, and they also have on the New York State Department of Health website for home health care people if there's any violations. If it's a licensed person, you can just check the department. I believe the Department of Education. Does this person truly have a license? And then get a camera in your house or apartment with your elder and document. Because if the agency has assured you that they've done the proper job of vetting and all that, but they haven't done it, you can sue the hell out of them. Unfortunately, when this decision comes, it's all rushing. It's in crisis. You're in crisis. So my other advice to people out there that are listening to this great show is plan, and plan. 95% of our clients at My Elder Advocate come in crisis. You know, when you're in crisis, is not the time to call in a professional, an advocate, or another type of professional who deals in elder care issues. I can still produce and do well by you and save your elder, but if you plan with a professional, when these things come along, you could handle them in a calm and, you know what you're doing, you know where you're going, you know what you're looking for.
Those interested in contacting you either for more information or for help on some level, how can they go about doing so?
Okay, again, my name is Jack Halpern. The name of our company is My Elder Advocate. We are a fee-for-service company. You can check out my blog, and our website is www.myelderadvocate.com. And we have a terrific blog that presents a lot of these problems that people are running across. My email address is jhalpern@myelderadvocate, JHALPERN @myelderadvocate.com. You can call me with questions. Be glad to answer them. And by all means, check with a professional, because most people think that when their elder gets sick, they're going to go in a hospital, they're going to go through relaxing recovery, then they're going to come home and everything is going to be rosy. And when they run into the hospital, life will change for that elder forever. If they broke a hip or have a stroke and they don't get the proper care, they will die. I'm not selling anything here. I'm just telling people that you have, when you're in this situation, your responsibility is to do every single thing that you have to do to save that elder. When a discharge planner says to you they have to go to a nursing home and they have to go to this nursing home, you just look them in the face and you say, no, I don't have to do anything. I will protect my elder. I will find out what is the right nursing home that can take care of him. I will get a professional. I will get a home health care agency that's taking care of my elder the proper way. And you are going to wait. It's not a damn thing that a hospital can do or a nursing home can do. You just tell them, I know the law. You have to do a proper discharge plan by law. And if you're not going to do proper discharge plan and my elder gets hurt, I'm going to sue you personally and go after your license personally.
Thank you, Mr. Halpern. It's been an honor having you on this show.
Thank you. It's been an honor. Thank you very much.
In closing, it should be noted that attempts were made to obtain comments from the office of New York State Senator Reverend Ruben Diaz, a Democrat representing the 32nd Senate District in the Bronx, and Bronx Borough President Ruben Diaz Jr. The senator was invited to respond to the following. 1. Prior to conducting this interview, Jack Halpern, CEO of My Elder Advocate, a New York City-based organization that provides assistance to elders on a number of levels nationwide, said, "The Bronx is the worst out of all the boroughs in terms of systemic abuse by home health aides." Were you and other senators representing the Bronx aware of this fact? If so, what measures have been taken to deal with the problem? And 2, would you consider drafting legislation calling for all home health aides to be fingerprinted? The senator and borough president have not responded. In addition, Visiting Nurse Service of New York and the Office of Attorney Howard Finsterman were contacted and invited to take part in this episode. They have not responded. However, if any of the aforementioned should submit comments, they will be read in their entirety and unedited during another episode. That's going to do it for this edition of the G-Man Interviews. I'm the G-Man, and I thank you for joining me. Until next time, stay cool, stay safe, and stay informed.